So hello everyone, and welcome to the first lecture for medical terminology. By now you should have watched the how to get set up for this course little lecture that I recorded, telling you how to get online, how to get the PowerPoints, how to get yourself signed up. By now you should have been signed up with the Evolve Elsevier system so that you can access all of the resources and also the tests that you'll need to take. This first lecture I'm going to cover chapters number 1 and 3. They're both fairly short and they're both kind of introductory. I'd like to give chapter 2 its own day because it's a little bit longer and more complicated. As a result, when you do some of the exercises for chapter 3, there may be a term or two that were introduced in chapter 2 that you won't know yet. Don't worry about it. We're going to do those over and over again. You'll really get good at those by the time you need to be. So chapter 1, we're just going to introduce what medical terminology is about. First of all, again, you should have set up your Evolve website system so that you can get on there and get to this page, which will have for each chapter some practice quizzes, which I may at times use as your regular quiz for that test, for that chapter, because you can email the results to me, or the assessments over here, which would have a little bit more gutsy tests in there that we'll use from time to time. The games and animations and stuff are a lot of fun. You'll notice that on chapter 1, not everything is available because chapter 1 is so introductory that there aren't a lot of resources. By the time you get to chapter 2, 3, 4, and especially farther on, you'll get more and more things that you can use. So, origins of medical language. Medical terminology is based on the assumption that everybody in the world needs to be able to communicate about medical topics. It would be nice if everybody called this an elbow, but they don't. You know, in China it's called one thing, in Russia it's called another. And so a long time ago they agreed basically to set up one language that everybody would understand. And the origins are kind of diverse. It wasn't one group of people who decided this. Instead, it sort of came together over time. So understanding this chapter and being good at this is going to help you get through the whole rest of the course, because how you put a word together will allow you to create or understand a word that you've never seen before. First of all, and in some ways the easiest, we have words that are built from Greek and Latin word roots. So ancient Greek and Latin are not true current languages, although the Greeks are lucky that they would understand most of these anyway. And fortunately for us, English is a Latin-based language, so we can sometimes understand some of these words. We'll think they're common words when they're really not. They're actually Latin-based. So we build terms with Greek and Latin word parts. You stick the pieces together to tell the story of the body part, the disease, the condition. We also have some medical terms that are named after the person who discovered them. Everybody that discovers stuff likes to name it after him or herself because then they become immortal. So we have Alzheimer's disease and Parkinson's disease and Huntington's disease. And it used to be that there was always an apostrophe S. It was Alzheimer's or Parkinson's. But they decided that the disease was named after him. It's not his disease. So it's not apostrophe S. It's Alzheimer's disease, because Alzheimer is the guy that first described it. An acronym, and that's an eponym. An acronym is we know that from general usage. That's where you take the first letter of each word and stick it together, like AIDS, AIDS, acquired immunodeficiency, syndrome, HIV, human immunodeficiency virus. And for instance, laser, light amplification by stimulated emission of radiation. It's a lot easier to say laser. And so that's an acronym. And then things that have come into being really recently, English is becoming more and more widely used among medical professionals worldwide. And so most, if we create something and call it a nuclear medicine scanner, everybody has to learn that. They don't turn that into a Greek word. So we have some modern language words for the most recent innovations. Review question, AIDS is what? It's an acronym, AIDS, the first letters of the words. So that kind of puts us into two really separate categories. We have one that's built from those Latin and Greek word parts, and so once you learn all the word parts, you just put them together that way. Or they're not. AIDS, Alzheimer's disease, and nuclear medicine, those are not made of Greek word parts. So those you're going to have to learn in a different way. Terms built from word parts, you learn the parts and then you stick them together. Or if you see a word, even if it's this long, you say, okay, well, this is the prefix. This is actually the word root that we're talking about. Here's the suffix that tells you what kind of disease it is, and therefore I know what it is. So you analyze and define the term that way. The others you just have to memorize. You have to learn what Huntington disease is. You have to learn what Parkinson's disease is. MRSA, an acronym, methicillin-resistant Staphylococcus aureus. Great, that's MRSA. And you just have to know that that's a disease, a skin disease that this bacterium is really hard to treat and all that kind of stuff. Complete blood count. Orthopedics. It sounds like it might be made of word parts, but it isn't exactly. It can't be defined by looking at the word parts and saying that's what it actually means. So you're going to have to memorize what that means. Parkinson would be first of all, what kind of word is it? It's an eponym. And is it built from word parts? No. Osteoarthritis is what? Well, oste is a bone, means bone. Arthra is joint. Itis means inflammation. So we have inflammation of the bone and joint. So that is built from word parts. So let's see what the word parts are that we're going to be dealing with. First of all, every medical term has to have a word root. It tells you what you're actually talking about. Arthro is the knee, a joint. It's a joint. So we're talking about something to do with the joint. You have to have a word root. A prefix would go on the front of it to say above, below, within, inside the joint, So a prefix is stuck on the front of the word. A suffix is stuck on the end, usually to tell you what the condition is. Itis is inflammation. So arthritis is, it's inflammation of a joint. And you often use a combining vowel, usually O, to make it easier to say. Because, where is it? Here we have arthropathy would be really hard to say. Arthropathy is not. So a lot of times if you have two consonants together, you'll stick a vowel in between them so that it makes it easier to say. A couple of times you'll use the letter I. Maybe there's once you'll use the letter E, but 99+% of the time it's O. So if you're wording a word root and a suffix like joint disease, and there are two consonants there, you stick an O in virtually every time. Arthropathy. So if the suffix does not begin with a vowel, if you have two consonants together, when connecting a word root and a suffix, the combining vowel is not used if it does start with if there is a vowel in there, because otherwise it would be hepatoic, which wouldn't be easier to say than hepatic. There's already a vowel there, hepatic. When you use two word roots, you almost always stick one in to separate them, even if there are a couple of vowels in there. Osteoarthritis. So usually if there are two different word roots, we're talking about the bone and the joint, you put an O between them to separate them. We're going to do this so much it's going to come real naturally to you as the course goes on. A prefix in a word root, you usually don't stick the combining vowel in there. Subhepatic means below the liver. Below the liver. But you don't have to say subohepatic, subhepatic. So there actually is a little break in the sound, subhepatic, instead of putting a combining vowel in there. So the times you usually do use it are between two word roots, or word root and suffix where there's no vowel already there. So here we have arthro is joint. These Greek and Latin words are kind of difficult to say by themselves sometimes. Arthro. Ven is vein. Ost is bone. Hepat is liver. Here's a couple of prefixes. Intra, sub, those are prefixes. You might have subhepatic, meaning below the liver. And a couple of really important suffixes. We're going to add some with every body system, because there are some words with each system that kind of have a new flavor, and so they'll give you a new prefix or a new suffix that you'll typically use just with that body system. But you're always going to be using these guys. Itis is inflammation, as I already said. Pathy is disease. So hepatitis is inflammation of the liver. Hepatopathy is disease of the liver. Ick, pertaining to. Hepatic. So hepat is liver. Something pertaining to the liver would be hepatic. Us is another suffix meaning pertaining to. Venous, like a venous shunt, a venous blood draw. And your combining vowel almost always is O. What is the core of the word? The word root. Everybody's got to have a word root. So the combining form, which is what we're going to use most of the time in this course, instead of giving you that funny, hard-to-say word, if it's a hard-to-say word that almost always needs the O stuck on the end, then the combining form has the O already there. So arthur is the word root. Arthro is the word root plus the combining vowel, O. And together they make the combining form. Hepato, veno for vein, osteo for bone. And so these are combining forms, the word root plus the combining vowel. So, word root, hepatitis, hepat. Suffix is itis. The prefix subhepatic would be on the front. A combining vowel in the middle, hepatomegaly, means an enlarged liver. Combining form, hepato, the word root and the combining vowel. All medical terms have at least one word root. Some have two, even three. You may or may not have a prefix or a suffix. Combining vowels used to connect word roots, or a word root and a suffix where there's not already a vowel there. Suffix begins with a vowel. You usually don't use that combining vowel. Osteoarthritis. These are two word roots, so you do use it. Often, the best way to analyze a word is to start at the end. What is itis? Inflammation. Inflammation of the joint and bone. Inflammation of the joint and bone. You can say joint and bone inflammation, but usually the easiest way to define it is to start at the end, see what's wrong with it, and then see what it's wrong with. Osteoarthritis, inflammation of the joint and bone. Every once in a while, you'll have one that just by the way it's laid out, it's easier to start at the front. For instance, melanoma. Melano is black, oma is tumor. It's easier to say black tumor than tumor black, or it makes more sense. If vowels are present, when there's two word roots stuck together, even if they both have vowels there, do you use a combining form, combining vowel? Yes. If they're two word roots, osteoarthritis. Still used. So let's do an analyzing of these medical terms. As I say, as you get farther into the course, you won't take the time to do this so stringently. You'll say, that's inflammation, and it's that and that. But the first way to figure it out is to go through this defining process here. So we have osteoarthropathy. What do we actually have here? Well, there's a word root, and there's a suffix. And there's a couple of combining vowels. So you could say word root combining vowel, suffix. And then you could combine this word root and combining vowel into a combining form. So you have two word roots, two combining vowels, and a suffix. You have two combining forms and a suffix. Osteoarthropathy. If you're looking at the other way around, disease of the bone and joint, disease of the bone and joint. You can build it, so you can go from either direction. You can look at it and say, okay, what is it? Or if somebody says you have to say disease of the joint and bone, you say, okay, it's a pathy, and it's arthro and osteo, osteoarthropathy. Okay, so you can build it from pieces, or you can pull it apart and see what it is. Here's some of these we've already used. Arthro is joint, hepato is liver. These are combining forms because they already got the O stuck on. Veno is vein, osteo is bone, combining vowel is O, intra is within, sub is under, and we have itis for inflammation, ic pertaining to, us is another pertaining to, and pathy is disease. So what would you do with arthritis? Well, itis is inflammation. That's a suffix. And arthra is a word root. You don't need an O in here because you already have an I. So what you have is a word root and a suffix, meaning joint inflammation. Intravenous, us, means it's pertaining to the vein. Intra means it's inside the vein. So pertaining to something inside the vein. An intravenous, an IV line. That's what when you put an IV line, you're putting in an intravenous line. It means it's going inside the vein. Osteitis, itis is a suffix. Osti is bone, so this is inflammation of the bone. Word root, suffix. You see how this goes. Osteoarthritis, inflammation, joint, combining vowel. Ostea is bone, inflammation of the joint and bone. Subhepatic, pertaining to, ic, suffix. Hepat, liver, under, pertaining to something that's under the liver. And so forth. So here's the way they're actually being done. You had the slash in there, and then you say what it is. Define what it is. Word root, suffix. Okay? Word, joint, itis, inflammation, inflammation of the joint. So you can see how that goes. It's cumbersome at first, but it will get you on the right track. So now let's build the terms from the other way around. Inflammation of a joint. Well, it's going to be an itis, because that's inflammation. Joint is arthro. Okay? Except you don't need an O. If you already have itis, there's an I there. So it's just arthritis. So you're building it with the suffix and the word root. Pertaining to, within a vein. Us, vin, intra. Intravenous. Suffix, word root, prefix. Put them together. Pertaining to under the liver. Ic, hepat, ic, subhepat, ic. So you can see how you can start out with a word and break it down, or you can be asked to create a word and build it. Hepatitis. Arthropathy, osteopathy. So here we have osteopathy, arthropathy, hepatitis, subhepatic, osteoarthritis. All of these words we've already been using, but you're getting a little bit more comfortable breaking them up and putting them back together again. You can also be asked, well, look, here's inflammation of the bone and joint. Oh, goodness. It must be osteoarthritis. Itis, not pathy. That would be disease. Osteoarthritis, inflammation of the bone and joint. So which of these is analyzed correctly? Well, Y isn't by itself. Pathy is good. Okay, so these both have that right. Arthropathy. Which is it? That's not a prefix. That's a word root, arthra. So that's wrong because that's not a prefix. Word root, arth, combining vowel, together they're combining form with the suffix on the end. B. Okay, that is chapter 1. Here we're going straight into chapter 3. So now to be able to describe things, you have to be able to tell where they are too. Not only what they are, but where they are. You know, how would I describe something that's just farther away than the elbow? Or just a little bit closer, or a little bit toward here or outside? Or something that's in front of the heart compared to behind the heart? If you're looking for where a cyst is, or a cancer, you know, how are we actually going to describe to someone over the phone or via text messaging or something where this thing is located? First of all, let's do some directional terms. They'll tell you the position of things compared to something else, compared to the elbow, compared to the heart, compared to the lungs, compared to the stomach. The anatomic planes are used to determine what movement. We move in 3 dimensions, in 3 planes. We go forward, sideways, and around. Those are our 3-dimensional movements that we have. You can prevent somebody from moving their arm if you damage a muscle that's in a certain location. So we have to have that. And also, it will help determine the kind of view you're getting from an X-ray, an MRI, a CT scan. Am I looking from here? Am I looking from here? Am I looking from here? Is this a frontal view? Is it a sagittal view? And then body position terms tells you how the body is laid out. Are you lying down? Are you on your stomach while you're being examined? And then the thorax has the lungs and the heart in it. You know, a leg is a leg and an arm is an arm. But in the below the diaphragm and above the hips is the abdominopelvic region, which has all your guts in it. It's got your liver and your spleen and your pancreas and your stomach and your kidneys and your large intestine, your small intestine, your bladder. You know, all of this stuff is somewhere. And if you have a lesion, if you have pain, oh, the patient is experiencing pain in the right lower quadrant. Oh, right lower quadrant, that's very likely appendicitis because that's where your appendix is. And the regions break it down even more, so you can be more specific. Quadrant just means you're cutting your abdomen in quarters. Regions, you're actually getting 9 smaller areas that you can describe. So we'll start off with a good starting point, which is standing in the anatomical position. You're standing up, you're facing the doctor, your palms are forward, your thumbs are turned out. This is the anatomical position. So this is up, this is down, this is out, this is in, this is front, this is back, and this is close, this is far in that position. Now if I'm like this, you know, things are going to change some, but once you get used to where the arms would be in the anatomical position, it's a little easier to describe things like that. Combining forms for directions standing in the anatomical position. Antero is front, like the anterior. Postero is back. Posterior, everybody knows where your posterior is. Caudo, the term caudo actually means tail. A mouse, the caudal appendage. 3 blind mice. You know, did you ever hear the one, 3 small rodents with impaired vision? You know, that all, she amputated their caudal appendages with a culinary instrument. She cut off their tails with a carving knife. So the caudo is toward the tail. Cephalo is toward the head. A cephalopod is an octopus. It's a head with feet. Cephalopod. Cephalo is toward the head. Disto is farther away from the body center or from the attachment point. Proximo is closer to the center or attachment point. Dorso is towards your spine. Think of a dorsal fin on a shark in the dorsal direction. So if I'm leaning over like this, it's hard to say what's front and back, but dorsal is always going to be toward the spine. Ventro is toward the belly. Dorso, ventro. Okay, we have cephalo, caudo. Toward the center is medio, toward the middle. Toward the sides is lateral, latero. Medial, lateral. Anterior, posterior. Cephalad, caudad. Caudo, cephalo, caudo. AD is what you put on the end. Also, we use to be above something or below something is superior and inferior. So, if you're saying what's right above the heart, just superior to the heart, just inferior to the heart, just medial to the heart, just lateral to the heart. Anterior to the heart's right in front of it, posterior's right behind it. To some of those, we'll add a few prefixes and suffixes. Bi means both. Bilateral means both sides. Unilateral means one side. Unilateral blindness means you're only blind in one eye. Bilateral, you're blind in both eyes. Unilateral paralysis. Bilateral paralysis. You're paralyzed on both sides. Ad means toward. That's where I was going with caudad, not crawdad. Caudad is toward the tail. Cephalad is toward the head. And Eeyore, like Winnie the Pooh, Eeyore. No, Eeyore, and this means direction. Anterior, posterior, superior, inferior. What's the prefix here? Well, that's easy. It's the one with the slash after it, right? Anyway, bilateral. So lateral, will you be talking about pertaining to the side both? Both sides, pertaining to both sides, bilateral. Spell terms used to describe directions. So we already have gotten into this pretty well. We have cephalad. Cephalo is head, so cephalad is toward the head. Caudad, toward the tail. Lateral, toward the sides. Medial, toward the middle. Proximal is closer to the body center. Distal is farther away. So my elbow is distal to my shoulder. My shoulder is proximal to my elbow. Superior, above anything. Inferior is below anything. Superior to the stomach would be right above the stomach. The heart is superior to the stomach. Anterior or ventral is the front. Posterior or dorsal is toward the back. And one thing I will say is that you will find yourself in the unfortunate position of everybody in the world where sometimes you have two words. One came from Greek and one came from Latin, and they just decided to use them both. So you got to learn both of them. And if you want to say from here to there, antero-posterior. An antero-posterior shot would be starting here and looking that way. A posterior-anterior shot would be starting here and looking that way. X-rays go through you. They don't just look at the anterior portion of your belly. They look through you from front to back or through you from back to front. So antero-posterior, postero-anterior. Chest ray position. This is going to be an antero-posterior view. If he turned around, it'd be the other way. What's two sides? Bilateral. Okay, now let's do the anatomic planes. These planes of motion are the way that you can slice a body so you can look at it with an X-ray or an MRI. Your planes are three. You have the frontal plane, which is even with your front, so it goes this way. If I'm standing against the blackboard, I can move in the frontal plane. I can't do this very well, but I can do this. Cartwheels and jumping jacks are done in the frontal plane. If I abduct my arms at the shoulder and adduct them again, those are frontal plane motions, even with my front. Straight cutting me through this way and dividing me into side-to-side pieces is the sagittal plane. The mid-sagittal line cuts me right down the middle of my nose and divides me in half, right and left halves. Any sagittal plane, though, is in that same direction, but I could cut it here, here, here. When you do an MRI, it takes a whole bunch of slices, but if you're in the sagittal plane, you would be in the sagittal plane all the way through. Only one would be truly mid-sagittal. Marching straight ahead, doing a somersault, those are sagittal plane motions, front and back. Not even with your front here, but anterior, posterior motions. Flexion and extension of the elbows. Flexion and extension of the knees. Nodding your head. Those are sagittal plane motions. And the transverse plane, parasagittal, they're just saying it's in the sagittal plane, but it's not the mid-sagittal one. So it's here somewhere, but it's still that same plane. Transverse plane cuts you, this is the hara-kiri plane. If you want to slice yourself like this, you're cutting yourself this way, and if someone were to look at you, then they'd look straight down into what was left of you. A lot of imaging will do this. It will look from the top of the heart down through the chambers toward the bottom of the heart. Okay, so this is the transverse plane. Pirouettes, shaking your head side to side, rotational type motions. The spinning, twisting motions take place in the transverse plane. Frontal plane, sometimes called the coronal plane. Usually, if it's called the coronal plane, it's some kind of like a CT scan image. And coronal means crown. It's not this kind of crown. It's the kind that goes over the top like this. Coronal plane is the same as frontal plane. Sagittal plane, mid-sagittal is right in the middle. Any other sagittal or parasagittal is the same direction. And transverse plane cuts you that way. So one, it's kind of hard to see these, but this green one is the one that's going through her this way, side to side here. So that's going to be the frontal or coronal plane. The one that's cut in front to back here, right down the middle of her front, is the sagittal or mid-sagittal. And the one that cuts her this way is a transverse plane. We have a few positions that you can put the body in. And if the person is in that position, then you have to know that's the way they're aligned before you start trying to describe where their various body parts are. The Fowler position, very common if somebody's in the hospital and they need to sit up a little bit to give their back a break, maybe read and elevate their knees slightly. So you raise their knees and raise their back slightly. That's the Fowler position. Prone is lying on your stomach. Supine is lying on your back. Both of those are recumbent. Well, the person had this, blood pressure when they were recumbent compared to upright. Upright means you're standing up. Recumbent means you're not. You're lying down somewhere. But while you're recumbent, you can be on your front or your back, on your front, you're prone. On your back, you're supine. Orthopnea position, that's sitting up so you can breathe easier. Sometimes people have to do an orthopnea position at night if they have sleep apnea. They might have to sit up so they can breathe better. Trendelenburg position is lying on your back with your feet up, your feet higher than your head. Either the whole body's tilted or your feet are raised, and this is what you do if somebody is having shock to try to keep enough blood in their brain to keep them alive. That's a Trendelenburg position. And there's one other position that's not on this slide that you ought to know. Make note of this. It's the lithotomy position. I don't know why they call it lithotomy. That actually means cutting out a stone. But the lithotomy position is a woman at the gynecologist with her feet in stirrups, lying on her back with her feet in stirrups. That's called the lithotomy position. I think one of your practice tests has that on it. Sitting up. Now this isn't really a perfect, this says slight elevation of the knees. I don't see the knees really elevated that much, but they say they are. That's the Fowler position. Trendelenburg position, feet higher than the head. So now let's be able to describe the location of your innards and the location of pain in your abdomen or pelvic regions. Your abdominal cavity actually holds the liver, stomach, pancreas, spleen, kidneys, and almost all of your intestines. Your pelvic quadrant holds just the end of your large intestine where it comes down the rectum and anal opening. It holds your reproductive and urinary stuff, so your bladder and your ovaries, if you're female, are in the pelvic. So the abdominopelvic region sometimes is lumped together, but actually the pelvic cavity is slightly separated by a sheath that holds the bladder and the ovaries and stuff in it. So here's the quadrants, just divided into fours. You have the right upper quadrant. Remember, it's this person's right. If I'm facing this person, that's my left, but it's that person's right. Right upper quadrant, left upper quadrant. Right lower, left lower. And remember, it's the right and left go first. It's not upper right quadrant, it's right upper quadrant. You need to know that because the abbreviation is used all the time. RUQ, LUQ, RLQ, LLQ. So what's in the right upper quadrant? Most of your liver and your gallbladder. So if you have gallstones, it's going to hurt in the right upper quadrant. Part of your large intestine, but not a part that is very commonly cancerous or inflamed. So, right upper quadrant is more likely to be liver or gallbladder related. Left upper quadrant is most of your stomach, your pancreas, your spleen, part of your intestine here. Right lower quadrant has a good amount of intestines. It's going to have your ovaries if you're female, your right ovary, your bladder, your right half of your bladder. It's going to have your appendix in it. Your appendix hangs off of the cecum, which is the end of the large intestine where it first starts. The appendix sticks off. So if you have right lower quadrant pain, it could be appendicitis. Left lower quadrant pain, a lot of intestines are over here, and part of the intestine has a tendency to develop polyps and cancers and things like that. So your pain and problems over in this region. There's another ovary over there, and there's a lot of small intestine. There's a big chunk of large intestine that has a tendency to be most compromised. Right upper quadrant, left upper, right lower, left lower. And remember the abbreviation. Now the regions, you're dividing it into 9 spots here, so you can be a little bit more specific. You have the highest up and on the sides is called the hypochondriac region. Well, this is an unfortunate name because what we think of hypochondriacs is people who think they're sick all the time when they're not. But in fact, this means below the ribs. Okay, it's below the ribs of right and left, so it's up here. Epigastric means above or on top of the stomach. Lumbar, we think of our lumbar spine as being here, so the lumbar region comes around here, but it comes all the way around here too. Because if you have kidney pain, it can hurt here as well as here. That's lumbar. Keep going down farther, and it's the iliac or inguinal region. The lowest region is the iliac. Remember the iliac crest from A and P. Also called inguinal because the inguinal canal that the testes descend through when you're born, if you're a male, is a weak spot on males for their whole life. And males tend to get inguinal hernias there. And it's on either side, as low as you can get, down in the abdominopelvic region. Going up the middle, we have the epigastric. We have the umbilical region, which that means your belly button. And hypogastric is below that. That's going to have your bladder in it. So hypogastric is even with the right and left iliac or inguinal regions. Umbilical is even with the lumbar regions. And epigastric is even with the right and left hypochondriac regions. So here we have left and right hypochondriac. Almost nobody's ever going to use that term because of its other connotations. Epigastric above the stomach. Umbilical, this whole center area here with your belly button about there. Right and left lumbar. Right iliac, left iliac, or right inguinal, left inguinal, and hypogastric, as low as you can get in the middle. For every chapter, you're going to have a ton of abbreviations to learn. And these are going to be critical to you. If you're going to be a CNA, if you're going to be a nurse, if you're going to be a physician's assistant, if you're going to be some kind of other medical assistant, if you're going to be a medical coder and biller, a lot of things are going to be written in abbreviations because everybody likes to go fast. And so LUQ, left upper quadrant, it's a good thing to know the abbreviation. So you're going to be working on abbreviations with every chapter. The good thing is in the test, it's pretty easy to pick them out because it's usually matching. And LUQ, you look down and you'll see left upper quadrant. It's like duh. You know, it's going to be relatively simple to pick them out, but still learn them, learn them, learn them. Anterior, anteroposterior, inferior, lateral, left lower quadrant, left upper quadrant, medial, postero-anterior, right lower quadrant, right upper quadrant, superior, sup to the heart, superior to the heart. And in every chapter you're going to do this. you're going to, at least on the PowerPoint, but also in some of the practice things, you'll want to go through the actual like medical records part of it and try to figure out what word they're saying or what word they're asking for in a real context. Patient presented with pain in the right lumbar region and right unilateral leg pain. Where's the right lumbar region? It's on the right, and it's here. It's not all the way down, it's about here. Going from the lumbar spine around here. Unilateral leg pain, it means it's just on that side. Pain was felt in the posterior portion of the leg and radiated to the distal lateral portion of the extremity. So it's all the way down and out to the side. Proximal muscle weakness reported in the affected leg. It doesn't work as well as I would like. Lumbar spine radiograph was normal. Doesn't respond to anti-inflammatory medication. She will be referred to an orthopedist. Sounds to me like she has sciatica. You know, some kind of sciatic nerve involvement, because that goes down the back of your leg and then kind of distal out to the side. Coronal plane or frontal plane, cutting you this way. Midsagittal plane, cut the head right in half with your imaging, and you're looking right up the brain stem into the brain to see if you can spot any lesions, bleeds. Transverse plane, cut across the middle looking straight down from the top. Kind of a fuzzy picture. Sorry about that. And that completes today's lectures, chapters 1 and 3. You'll want to go online, go through the practice exercises, the games where they're available. They are a good way to learn that's actually kind of interesting to do, more interesting than typical studying. The practice quizzes are really good. And then prepare for Chapter 2 in the next lecture.